Pediatric feeding disorder is when children can't feed themselves orally, and pediatric feeding is associated with swallowing problems as well. So it's pediatric feeding and swallowing disorders that we follow. It's been estimated about a third of neurotypical children can have pediatric feeding disorders, and up to 80% of children with neurodevelopmental concerns. So it's a very, very common problem, and it really impacts a lot of aspects of children's lives.
Kylie is 99% tube fed. She has had feeding problems right from the day she was born up until today. She still struggles with feeding, and all the diagnoses that she has play into her feeding problems. Kylie was born, and at first we thought she just had a cleft palate, which caused her to not be able to feed properly. She had to be admitted to the NICU, where a feeding tube was placed. And then she developed oxygen problems and needed surgery on her throat. She also started having really bad reflux, and she would choke and aspirate on fluids. It was very hard to adjust to a child not being able to eat, not being able to thrive like typical children.
We started the project off by basically having really a fact-finding mission, which was the World Cafes. And the purpose of those meetings was to ask for feedback from those stakeholders about what they thought was going well for children with feeding disorders, what was going not well and needed to be improved, and then what ideas they actually had. And it was very key that families were included in those World Cafes, and that it was an environment where they really felt they could speak up and be heard about their concerns.
From the World Cafes, they knew that care was siloed and families just didn't know where to get resources, and that things were very inequitable. And so that was kind of like what launched the website.
Prior to the implementation of PEAS, I remember spending a lot of time researching different guidelines, not being sure if it's the most up-to-date version or if it's the most applicable in that client situation. But now with PEAS and with the PEAS website, within a matter of seconds, I can pull up that information that I need and have that reassurance that it is the most up-to-date, and also know that it's consistent with what is being done in other areas of the province.
And so if a family member was in a clinic in a rural area with a provider, the provider could pull up the website and show them on the website why they're giving this treatment on the provider side. So that was very important to them, is to have transparency between providers and patients.
We have dietitians, speech-language pathologists, occupational therapy, physiotherapy, therapy assistants, social work, and also our early childhood intervention program coordinators. We all bring different strengths and knowledge and skills to the table when we're supporting families.
It's such a great program because everyone's trained, everyone is on the same page, and it's like a one-stop shop.
Whether there is a multidisciplinary team all in one roof, or if it's in a smaller community, those clinicians still have access to the same information and resources and education opportunities so that they can expand their competency in pediatric feeding and swallowing care, and that they are able to support families when they receive those referrals. They're able to access care closer to home, and it can cut down on their wait times to access that care.
Some days I sit back and I think, how did we survive the last 2 years? How did we make it through? And it's because we had all these extra people holding us up. And that's exactly what the PEAS team does. They hold us up. If Kylie can't eat and get her nutrition and all that support, like, it's her lifeline, and they are our lifeline. They support us in every way we need.
We want families to know that they can go to our website to get resources. And I think we want families who have children with feeding disorders to know that they should be heard. And if you speak out, then it's our responsibility to listen and hear. And we tried to do that with this project and create a culture that will continue to do that. So, definitely speak up and advocate for your child.
They make such a huge impact in not only the children's lives that they're working with, but the parents and the families, even the extended families. I don't think they understand how wide their help and support goes, because if we didn't have that support, then our family and the people that love us, they would struggle too. And I think they need to know that what they're doing really matters, and it matters to so many people. It just really matters. They're doing a good job.